All right, we've got a young dog here who's been vomiting, lethargic, and hasn't eaten in a couple of days. Based on the clinical signs and imaging, I'm pretty sure there's a foreign body causing an intestinal obstruction. So let's go ahead and open up the abdomen and find out exactly what's going on.
Alright, let me change my lights, making me, yeah, good.
I'm making a midline incision just below the umbilicus. We're going through the subcutaneous fat now. And there's the linea alba. Once that's opened, we're into the abdominal cavity.
The heart rate came up, my blood pressure is good, temperature should not be that low. Blood pressure.
There's two warmies beside him. No,
All right, now we're gently exploring the abdominal contents. First, I'm locating the small intestine, running it segment by segment between my fingers. I'm looking for any abnormal distension, discoloration, or firmness.
Check job. In here.
And here it is. This loop feels thickened and quite firm compared to the rest. It's dilated on one end and collapsed distally.
That was the thing I was touching it.
Yeah. I'm trying to undo the blood pressure and then re-put it on again.
Now that we've found the obstructed segment, I'm packing the surrounding area with sterile laparotomy pads. This protects the rest of the abdominal cavity in case there's contamination from the incision site.
Okay, Amanda, I need some flush on my intestine.
Before making the incision, I'm flushing the surface of the intestine with warm, sterile saline. This helps reduce the bacterial load on the serosal surface.
Temperature is still low and pulse still weak.
I just pushed the temperature in because it wasn't really in.
Take it out. Oh yeah, take it out.
Temperature?
Yeah. And put it again.
His body temperature is a bit low right now. That's not uncommon during abdominal surgery. We've placed him on a warming pad and covered him to help stabilize his temperature while we work.
It's right on the tag. The tag. The line.
All right, I'm making a small longitudinal incision right over the thickened segment. And here it is. There's definitely something lodged inside.
This is what it is. I don't know what it is.
It looks soft, but it's hard to tell exactly what it is at this point. The surrounding tissue looks healthy, no signs of necrosis, so we're in good shape to proceed. Now that the object's out, I'm going to flush the inside of the bowel again to make sure everything's clean. The edges of the incision look healthy. No leakage. I'm closing the enterotomy site with simple interrupted sutures using absorbable material.
I'm working on the blood pressure. Can I get you?
Once the intestinal sutures are in, I'll gently check for any gaps or signs of leakage by running saline over the site.
Good.
Before closing the abdomen, I'm doing a full exploration to make sure there's no second foreign body. Sometimes there's more than one. Everything else looks normal. The intestine looks good, so I'm returning it back into the abdominal cavity carefully, making sure there's no twisting or tension.
Okay. Surgery's done.
The patient is stable, anesthesia went smoothly, and we're starting post-op fluids and pain management. He should recover well over the next few days, X.
Not warming up. Do you want to untie his back leg?
Foreign body ingestion is more common than most people realize. Even soft objects can be dangerous. If your pet's behavior changes, vomiting, not eating, or seems in pain, don't wait. Early diagnosis and surgical care can save lives.
Okay. Gas down.